Just to move from here, pull. You are welcome, sir.
How are you? Thank you. James, how are you?
Okay. Nice to see you. My heart. It was a treat. It was nice. Hello. Nice to see you again. Mom, you're welcome.
Mwasinjerihika tata batashaba toba katula butunge wetu enu namabatangirira ndi mwasinja erihika usana n'umubiri outukakora hauma mwasinja namalekera tata.
Students, I was I'm part of the team, but when I left, some of these members were not there. But you're welcome to fill our gap so that the work can go on. Our dear sister, you are so welcome. We are so excited that you are here today. I'm happy to see my bosses. Mbaguma is there. Some of these bosses I've never seen them, but we are happy that you have visited our facility today, and we know very many things we shall be getting very many things from you as we continue the program. Thank you, Dr. Augustine. Thank you for bringing to us the visitors. We are so excited. Thank you very much.
Ndi mwasinjeri ya samu kama sinjeri balenda kandi inasima inaka wetu aiwa yutrostinga chiru che munabwire ndi wasinjeri tutangirero mwakeno sangwa bulo bwabe bwawange nana ushiye baitu mukali ya mukama kumugisa nero sana nebikebi usanga tuute tukanze riyowa eridwaye abayini betro gendikani abungaho nabwenda tukende bya hanu buhono kandi mukama nyatulinda mwasinja kutse.
The national health policy in line with the vision 2040 and of course the national development plan, the human capital development program, the program implementation action plan, and the strategic plan. And then they had to prioritize 2 health service delivery platforms, including the community health service delivery platform. And of course, never before Ministry of Health has the Ministry of Health been committed to establishing a well-coordinated, integrated community case delivery platform guided by the National Community Health Strategy. But now to accomplish this, to accomplish both of them, the goals, the community-based village health teams, that is the Vhts, have long been an essential component of Uganda, the Ministry of Health. And then, of course, they have put strategies to make sure that this comes out, but things have not, of course, worked well. But although government funding dedicated to the VHT and community level programs is relatively limited, progress has been made with financial and technical support from people in the communities of Greater Maliba sub-county, where we have done a lot of some work and supporting 22 VHTs and 10 selected from 10 villages of the Maliba sub-county, the whole sub-county. And it is, of course, implementing community-based integrated community case management and other prevention interventions related to assessment of HIV, tuberculosis, immunization, nutrition, and sanitation. These VHTs don't only treat, but of course also do assessment of these things. And of course, in 20% of the villages in the sub-county. So meaning that the 80% is still the data. And of course, I may not explain this below, the fever, malaria, because I know it very well. But also we will devote to them myself. And now, this data is for 2020 from January to December that we had to capture here. And in the whole year, we've managed 3,595 people in the whole year. And of course, if we check our previous data of the other years, there is a reduction. And the reduction is not that we have failed to give up we will not deliver the services, but it's an achievement. Treating. And then, of course, we had treated from other villages. Among this number, we had people who are coming from outside villages of intervention. And those were 1,023. And then the number of children who presented with fever, it is 2,977. The number of those who tested for malaria, other DT, we tested the whole number that presented with fever. And then those who came out positive were 1,968. And of course, children with RDT negative was 1,106. And children who presented with diarrhea was 733. And who presented with pneumonia was 1,528. The children who presented with danger signs were only 85. And who got treatment within 24 hours of disease onset were 2,473. And also this is an achievement. In the previous years, it was more than this. It was less than this, sorry. So, but we are seeing that people are also trying to, compared to the number that we had seen up there, this number is bigger. So the number of children who were referred to the nearby health centers were 330. And then we followed up 2,899. And our mission or our goal is at least to follow up all the children that we have seen. But we still, of course, lagged behind with that. Children with zinc, those who had presented with diarrhea, 732. Then with amoxicillin, 1,610. The number of children who were treated with Coartem was 1,985. And the number of children who died after treatment was 0. And this is a great achievement. Actually, since the program started, we have never registered any death of the child that has been treated then dies. So that's a great achievement. So that is a summary of the whole year, previous year, that the children we saw. But also, in addition to that, we have other activities that we do. And one of them is also the restock. So we have a team that is dedicated to do this, that they do the restock for the magic. Recognizing that, of course, this becomes one of our priorities, because we know that these VHTs cannot serve the community if they are out of stock. So even though we are stocked in our stores there at office, we may not need these VHTs to get out of stock. So it is our priority to make sure that here they have the stock and at office they have stock. So we have also another activity, the village health team supervision. And this initial training, actually, of course, the supervision helps us follow up on what they had been trained in their initial training. So to make sure that they follow the guidelines, they ensure quality of care, they adhere, of course, to protocols, accurate treatment, following the logarithm, as they will show us the logarithm that they follow, and then, of course, to have the IPC measures looked at, make sure that these people, as they are looking at the children, they are taking care of the children, they should also be safe. We don't need them to also contact other conditions from the patients. So also then we have to see that it is continuous learning and skill development. Every time we have our TOTs or our health workers visit these people, even the MACHI team visiting these people, most of the things is to make sure that there is continuous learning and skill development. Then there is also what we call problem identification and resolution. When we come to them, we always identify what is problematic. Sometimes when you tell them to, when you listen and you make sure you think they will tell you, sometimes there are things they will not mention. But when you come on ground, you will get them. And of course that is the importance of the supervision, collection and reporting. And this is also done every month. And of course this is also ensured during supervision. Make sure that they have the accuracy in that data tools. Another activity we do is regular refresher training for these Vhts. It is our mandate to make sure that these people have the trainings when it, of course, it is due. The whole team knows it better that we had to reduce on the way these people, because we could have the trainings quarterly, but of course due to funds, we have got challenges arising from limited financial resources, and this constraint often prevents adherence to planned quarterly schedules. Consequently, refresher training sessions are primarily initiated as a reactive measure, specifically when continuous repetition of mistakes or errors in VH performance has been observed. That's when we come up with a training compared to the past when they were supposed to be done every quarter. And of course, it has helped us also to overcome some challenges. So another activity that we do ordering medical supplies from joint medical stores. It is our activity that we have to, because of before this, we make sure that we follow up with our stores to make sure that we are not out of stock. And of course, this we have most of the time we have done it with you. When we need to do an order, we always discuss and make sure that we pass through the stock. Data collection and collaborative problem solving. In this data collection, as you've seen these Vhts gathered here, that's the format we always do. They gather the way they have done. So someone sits here down, looks at their register, picks the data, and of course identify the challenges. And most of the challenges we identify, these people are part of the solution, actually, the problem solving team. We have to look for the solution ourselves first before we think of another thing. And then, of course, when we find out that this problem, even when we have tried to put some solutions ourselves, we see that the problem is consistent. It's when now we come out and say, I think, doctor, we need a refresher training. Yeah, because we have, but most of the times, our trainings that are done when we are almost all together and doing the reporting. An activity is VHT on-site mentorship. Of course, this has been done mostly with the coordinator. Of course, we come and monitor them. What I had said earlier on, that when we come on ground, there are other things we may. And of course, given the nature of our people, you solve a problem to them, you think you've done it, the next time it has come again. So that's why you always have to come to do routine on-site mentorship. Yeah, because today we will talk about consumption logs. Tomorrow you come back, the register is worse. When you come back, the consumption log again has gone wrong. So it is something continuous, and you make sure that you do it every day. Have monthly reporting, monthly report generation. This is done in office, mostly in Goye, when we have compiled our data. Before this, we have to do data review and entry. Then we upload the data. Then we compile the report. And this report is monthly that we share with the peers. The programs manager comes out with the whole, he adds it with the other report of the month for the office. But on a monthly basis, we come out with a report that gives information about the project. Then there is this one that we have done. Retaining and keeping the 22 Vhts is also another job. These people, the dropout rate is, if you could just lag and sit behind, you will find that you have no VHT doing work. So making sure that all of them are still on 22 is also another task. Yeah, because you have to come up with, of course, many programs that keeps them here. And of course, we have come out, most of the time, we have come out with a livelihood program that you initiated. I'm happy that it is working, as we shall hear as we go. The activities that we have also been doing, this is of lately, that we have also been following up on the Rotary grant, though it is a big challenge, as we will read in that report. I'm summarizing this report in some words. I know because I will share it with you. You'll have a simple time. Please, I beg. You'll read it. It has a lot of information. And when you read it very well, it will give you the real status of the project. The way it is. So on the Rotary grant follow-up, Dr. John has done several things to make sure that we go through this. But of course, things have not gone well. So another activity, then we have livelihood activities. And of course, as you see that picture, number 1, we distributed pigs that will give us the first funds to open this program. And the first beneficiaries was Tom and the Covia. So we are happy that they did the project very well. Actually, currently, we are having the other beneficiaries, other than Tom and Scovia. We have Naume, we have Nyabana Ruth, we have Kavuo Joy, the one we are visiting today. We have Kavuo Oliver, we have Master Mary, from Jezebel, Evanis, Medrin, Jailes, and Harriet. These people have benefited from the program, and I thank the ED who has been spearheading this to make sure that we have this. Because in addition of the two pigs we had, then the ED, of course, when he had chance, when he came on the ground and he saw what is happening, he was like, no, let everyone has receive a pig. And of course, there are those who have not received the pigs, and of course, we have looked. They were like, of course, we cannot have the pigs because of some other situation. So they are waiting. The ED is thinking about it currently now. So as we shall hear from him. So also the list is there. Those who haven't received the goats, and they are waiting. So in livelihood activities, we have also done agricultural education and capacity building. And these things, we do them to make sure that these VHTs can earn something, and of course they shouldn't think of going somewhere and look for other jobs. Make sure that they can get some income within their pocket. So because most of these people are farmers, then we have to look at agricultural education and capacity building. And in this, we had looked at poultry management. As we shall see when we are getting out of this house, our VHT here, Joy, has done this very well, the poultry management. Her livestock, and because of these trainings, most of them have learned from her, and that's what we want. Where she is, that's where I want our VHTs to be. they should not only, we don't want VHTs to be looked at in the community as poor people. Yes, they should also be looked at as moderate. At least they should be somewhere. Yeah, they should serve the people when they are satisfied. Yeah. So people have come here to learn from this lady, and of course we have also gone to some other. Actually, every VHT here has a different thing that it does well at her house. So what we have an initiative whereby every month we visit every household on the reporting day. Not only just for reporting. After reporting, we have a session on that. But after the reporting and having our problem solved. So other than the poultry, we have coffee processing. Then we have the banana plant management and other things. So another thing we have done, we have got 4 beneficiaries every month, every time we meet, and of course, in the 1 year, just 1 year, we have a rotation of 2,400,000 that has gone throughout them. So we get 4 beneficiaries, and each beneficiary is given a small token that he goes with. It is not a loan. Yeah, we have tried to prevent some loans. Then, other than that, there is another initiative they created. Whenever we visit someone, they leave with someone a simple token on a monthly basis, and they collect 110,000 and they give it to one of them. And of course, this money to just go and enjoy around. We think and ask that this VHT should receive this small token of cash, and he uses it also to improve on his livelihood. He should improve on his project. Like, for example, we have those who have pigs, and on that day we tell you, I didn't have feeds for the pigs. That money will help him run his project on that day. And of course, then on that account, we have got an accumulation of 7,200,000 that has passed through them. And this money has been risen by them, supplying it within themselves, and to make sure that everyone is trying to be happy. And of course, overall, our impact on this has at least reduced the dropout rate of these people. That's why you see them, they are smiling, others are smart. And the community thinks these people have salary, but they don't get any coin. But they make sure they do this work within themselves to make sure that they are smart and to make sure that the people are served when they are happy. And we have tried very much to avoid the issue of loans, because if we implement loans, some people will fear to come for ICCM activities, which is the primary goal for everything. So when you implement a loan, someone will start fearing and they will not come. So we always give this money as grants to these people themselves. So we have some challenges that we have faced over time. Of course, the limited funding that you know very well that has impacted on quarterly refresher trainings. These VHTs always have, previously we had the quarterly refresher training according to Ministry of Health, the way it of course recommends. Then this limited funding has also affected the match management meetings that of course without these meetings, at least of course the publicity of this program in the management or in the leadership of the sub-county, the civil kind of, it is also absent. So we may do good things here, but of course the management of the sub-county, the leadership, of course they will know little about it. Then also the procurement of VHT bags. The bags that we procured to these people the first time, those people whom we had from the start, they are all thrown out and they cannot carry anything with them. So we only have those who are very new that came in that still have their bags. But the raincoats, the bags, the gumboots that we had brought at first have of course gone out. So because of the limited funding, we have not managed to succeed in making it out. Then we have also high community expectations beyond the program scope, where even the elderlies, they want us to, these people to, the senior citizens want these people to measure hypertension, and these people cannot do that. They only for children. And if they have not done that, then they start complaining that there are things that they are taking. For them, the community thinks that you send services beyond what these people serve. So of course, after that, it becomes a problem. So then, of course, even having done all these interventions, there is still the dropout rate is still, of course, though we haven't, because our target is to minimize it to 0%, but it's still there a little bit. Then also have failure to secure the local Rotary Host Club for the international grant. We have suffered for this. We have tried all our best, but we haven't achieved this. Then we have also the rampant transfers of the key Mukat healthy workers. So our TOTs that have been supervising these people, almost the ones we trained with at first, have all been transferred, including the in-charge, Mr. Stephen Kuruziza, who started with us and did a tremendous work making sure that this project is a good one. And he has been, of course, transferred. So we have also not only challenges and activities done, we have appreciation and gratitude. We appreciate, so we extend our gratitude and appreciation to Dr. Raquel, Dr. John, Dr. Ross, and the family for their sustained and generous contribution. And this has been, of course, it has been touching. For sure, you've changed a lot of lives in the community. Because the only problem is that it's not a problem, but a challenge, something like that. We come and we spend only 1 week, but if we could spend more than that, you could see and get a chance of seeing these caregivers. You hear from them how this program has changed and touched lives. We also thank the PHIL management, which is led by our ED, the director. Thank you very much, and of course then the dedicated staff for PHIL that has made this project at least look the way it is and stay up to the way they are now. We also and town council leaders. These people have been there for us. Every time I run to the health center to the chairman LC3, he's always there for us, Mr. Abdul Sadi, and his term has ended. We hope to receive another chairperson who will be also there for us, but we have to thank him. His efforts cannot go unnoticed and recognized. We also thank the TOTs of Mukati. Of course, every time we have a training, they are stepping in there for us. Whenever we have supervision, these people are always there for us. And then, of course, Mr. Nkuruziza Stephen, we cannot go without thanking him. He gave us that room that we always do our activities, and PHIL has used it for several activities. And of course, Machi has benefited much from that. Nkuruziza has he did most of the things in it because he even made sure that he gave us the TOTs without even hesitation, and of course the advice he gave us as a health worker. Finally, but I would request that I read this. Finally, and perhaps most importantly, we extend our heartfelt appreciation to our own Machi VHTs. These people are heroes. These frontline heroes are the backbone of our operation. Without them, I don't think there is anything we can achieve. And of course, their dedication. Sometimes I don't know even how to describe their efforts. Because when I describe them, sometimes I get out of the journey. I may even leave the line and go extra ways. So their commitment, their resilience, their direct engagement with community members are what truly drive the success and reach of our programs. And we have a small note that, of course, the Machi coordinator who is speaking currently now is now a student. He has gone back to school. He's doing his Bachelor's of Science in Public Health, and he would be grateful for any support related to this noble cause. Yeah, of course, in conclusion, the on-ground Machi team comprising of Dr. John. Of course, you may say Dr. John is in US, but he's becoming on the ground team. He's our foot soldier also. We have done most things with him. Augustine B, Emma B, Ibrahim. Ibrahim is that man. Ibrahim, first stand up. Yeah, Ibrahim is that man who replaced Herbert Ngelese. He's helping us with stores, but also helping us with the field work. So sometimes these people will raise a concern, we need medicine, and also I'm doing something, we will step in. When we come for reporting, I will be sometimes there are questions that I will be answering as he's collecting the data, or I will be collecting the data as also he's handling another thing. So that one person, for sure, it couldn't be a success without his support. And then, of course, along with Mr. Us with the livelihood project, and of course, we appreciate his efforts. This report has been compiled by that team, and the request has been led by the coordinator, and it has summarized. They had the report, but because of time and most of the things they had written were part of this, I would wish you we just give you a copy, you go with it, and then you would of course compare some of the things that are here with those, and that's our brief report we have. Thank you for the time. So there she has welcomed. You continue. So she has welcomed the caregiver, and they are trying now to ask and say assess, and she's trying to follow that guideline. So what she's doing, because the child said she had fever, the caregiver said the child had fever, so she's trying to test for malaria. But I would wish our child don't prick that child. So she has picked another DT for testing, but today our child will not be pricked because it's a demo. So Mangalekana now will say with the process. So she's assuming that the child was positive, and so she has given the treatment according to the age. She's also giving advice to the child, to a caregiver, on what to do, like completing up the dose and not sharing the dose with another child.
The village and of course the leadership of the VHTs who are here. And in a special way, I want to thank Dr. Ross and Raquel and the family. They have talked about what they are doing and for being committed to support Maliba and especially Machi. So the time when I come, there are a few things that I say. I hope what I say sometimes happens. Does it happen or does it? Okay. You may fear to say if we say no, it doesn't happen when it's here. But since I'm always monitoring and I've had the report, some of the things have been happening. So on behalf of PHIL, we want to appreciate the work that you are doing, especially for your community. And if I'm not mistaken, you may still be the most active now VHTs in ICCM in Kasese district. So it is a very wonderful thing for us. Don't worry that we have not allowed all the demonstrations to happen, because honestly, the team here, Dr. Ross, the husband, have been here with us and have been seeing what you always do. So it was for the children also to see something that you are doing. So I'll not really take long because we have a busy day. For me, my standing here was to appreciate you, but also mention this before I sit or before I invite my colleague to say something. We promised when we did the assessment of which people had to receive the piglets. It was done well, and those who were ready, I've had the list. Those names they have read, is it true you received the piglets?
Yes.
Okay, so don't fear him. If they didn't come, you should say no. Because we are here to confirm that it happened or it didn't happen. So I'm happy that it happened, and thank you, of course, the livelihood coordinator and your coordinator here for making it happen. And I remember there was something which you mentioned last time and we noted it. There are people who would love to not have piglets, but have kids, the goats. And I know the assessment also done for those who are ready to receive the goats. So I think after departing here, when I am very sure and the team, I'm going to talk to them quietly. And if we are ready, we are going to see with the finance team to see that also that happens. Those who are ready to receive their goats, because those who receive the piglets, and we promise also those who receive the goats will receive them. So that one I hope should also happen in a few days. So I want, as I conclude the final and list, all you see the support which comes through PHIL, it is really through the effort of Dr. Ross and Dr. Raquel. Because without Dr. Ross writing the grants that they write and they win, and because for us we take care of the money, we are given a little portion as PHIL, and from that PHIL portion that we are able to support what is happening. So we appreciate them very much, and of course together with their counterpart, Professor Edron, we have made some time back. So with those few remarks, I want to invite Dr. Raquel, who is part of the directors for PHIL, and who's really, if I was talking about who's providing oversight to Machi, and who has come here with the family to appreciate you and also greet you. Dr. Raquel.
The first program was a VHT program. So there was the other side in Bugoye, and now we have spread here to Maliba, and all of that work that you do, thousands of children, you are seeing them, you are caring for them, and their mothers, the mothers that don't have to carry them to the health center because they can receive treatment here in the village, and there are no deaths. You are saving those children. That is the work you are doing, and you are doing it of goodwill. You are not giving salary. We try to give you some support, but you are doing it because you care about your community. And it is very moving for us, for you to be doing this, for us to support your work. And we thank you so very much for doing it. Even with the little funds, we are running on skeleton funds. You are not getting some of the refreshers, but you are going along, you are doing the work tirelessly. Without fail, here you are doing it. And so we are very grateful to you for all that you do. Mwasinja Kotebo. We will make sure we continue to support your efforts. Thank you.
Not only cameraman.
Got some money, the money we always get every month. There's some small money given, yes we get. When she got that, so this can come and do and at least copy something and also use the lot of their money. So with that money of the people, they produced. We started selling some of the people to get some small money. Then as that thing was going on, I said, also to support us. Other big things are coming up land. Some of them have brought their money, also they have tried it in their homes, and they can be able to get some pen. Yeah, the pigs are easy. Just buy a pig, they vaccinate it something after. So the young ones are here. They just do the 3 days. And we run the homes. Yes. So I know here some of the gypsies are given pigs from people, from the pig. I know which she got from the pig. Only 2, but they kept on producing until I saw that no, let us make this one. So that and there are now many. They are from these 2 piglets. I think this one can go to 250. Roughly 200. Yes.
So my name is Ntaro Moses. I work with the PHILD. PHILD is an NGO that was really formed through the relationship that Mbarara University and the community, especially in Kasese, focusing majorly in Bugoye and Maliba, where we thought that we could also have another work together with an NGO which can also support the other functions, the relationships that we're already having with these sub-counties, particularly Bugoye and Maliba. And in terms of supporting VHTs, this work has been a work that we started many years ago. We can say over a decade. The VHT program started majorly in Bugoye, and then later being supported by a collaboration that we had with Mbarara University with the MGH, that's a hospital in the United States. And as a spin-off through that relationship, where we started a very powerful VHT program that was covering the whole sub-county. But Maliba, being our neighbor, was saying that how comes for them we have not done much with them, and that's how this seed, I can call it a seed, the VHT program began, and we have been also in Maliba, I think, for also close to 10 years. And the particular support that we have given the VHT, one was identifying the VHTs. After identifying the VHTs were trained in treating children under 5, especially for malaria, diarrhea, and pneumonia. Number 2, through this support that we under PHILD, the match program, Maliba community health initiatives. The VHTs are provided with drugs, the medicines, the supplies or the supplies. But very important, like we know that VHTs are volunteers. They would not be able to get any income to sustain their families. So there was a birth of this livelihood project that the VHT still through PHILD, the VHTs have been organized. They have all been supported to have at least a pig project in their homes, those who are able to have pigs. And then those who cannot have pigs, they are those who want to have goats. And so the project is organizing to give them kids, the young goats, so that they can also have a project. And I think with that, if you've had every year almost evaluate close to 4,000 children who are managed and treated in their homes without first going to the hospital to get care. So we think this has supported the community, and we also look at this spin-off, the livelihood projects to come out from just on the VHTs and also get to the community members. As the plans of growing, of course, PHILD is not like a very big organization, because like I gave its background, it started by the few researchers who worked with Mbarara University and the community members where they were doing research. In terms of growth, I think as PHILD grows, we look at a multiplier effect, because if PHILD has grown, we don't have reboundaries. I think as we engage stakeholders and see where there is much need, we can still support some communities beyond Maliba. But then we can only do that as soon as we are having some funds to support other areas. But for now, we are still focusing, especially in Maliba, because we haven't even covered the whole of Maliba. But looking at where we started from, the 10 villages where we began from, how can this, especially the initiative, in terms of the livelihoods, how can this initiative from only the VHTs go the community members? And then from the community members, we can also move on to other villages. You see that this moves on from one area to another.
Okay, yes, my name is Dr. Raquel. I've been staying this side in Uganda. I first came 13 years ago, 2012, and began doing work first in Bugoye sub-county, based out of Bugoye Health Center 3. And since that time, we have been expanding the work that we've been doing, but some of it is research-based, some of it is philanthropy-based, so we do focus on VHTs, because the VHT is really the level one taking care of the children in the villages. So we focus on that, and that one is not for research, it is just for support, for charity and giving and supporting the community, supporting the VHTs who are doing all of the work to try to help the children of the community. At an NGO called PHILD, and that was many years ago now. And together with them and some funders we have that side in USA, we have been raising money to support this program, and also using the research dollars, the grants, to get some little funds to support the PHILD, the NGO that we have. And the NGO focuses not on research, but just on giving to the community and providing the funding for the VHT program here, which is called Machi and Maliba.
I'm called Baguma Henry, and I'm in a place called Maliba, Bwizigwera sub-county, Muguku. So we started with the PHILD in 2019, and we started with the treating of the children on village level. So as the PHILD went on, so there came in another program of giving out support, like piglets to all the VHTs. So out of that program, we managed also to top up another program of soliciting our funds from the PHILD. At every end of the month, whenever we report, we get money, we give it to one individual. So out of that money, I bought the 2 pigs from the PHILD, and they multiplied. So they produced. So we kept on selling the piglets as we pay school fees of our children and running our homes as usual. So out of those piglets, some of them were sold, and we got a dream of also starting another program of the chicken. So we brought in the chicken. We began with the broilers. we could get broilers from our suppliers. We rear them for 1.5 months, then we sell them again to the farmers. We got the money. So after we got that money, we again brought in we got another vision of how we can extend the farm. So we sold the pigs, we sold some out of the other broilers. So we started the layers on a low basis. So we started with like 200 layers. So we are guided how we can increase the chicken. So right now, as we are talking, we have got 500 layers in here. But all that is the support of PHIT. So this project generally is from PHIT, because the money that we began with was from PHIT. However, we have also tried other sources, but the real key money we got is from the PHIT. So we really thank you, PHIT, for the great impact you have impacted on us. So here, other farmers have come here to also get some knowledge from here, learning how to rear pigs, learning how to rear the chicken. Out of the small money they are getting, even the model farmers, they also come here. Yes, so they have also, because this project, we thank PHIT, because even the model farmers couldn't come here if PHIT couldn't have at least given us a hand. So that's what I can say we have achieved. More especially here, school fees, we pay school fees. We have tried to raise some other structures. So it's an achievement. The request is more especially here where we are. Yes, we can have the animals, but we still have a challenge of water. Getting water for the animals and for the pigs and the chicken is also another hard problem. But if we can get support and they get like the water, which they call it water from irrigation system, underground water, then we can run the project very well as we extend it to other Vhts, and also the community can also benefit. Because whenever you rear a piglet and it produces the babies, we give them to other Vhts. So it keeps going on like that. We hope maybe one day it's going to be greater than this one. So that's what I can say, like the challenge. Most challenges we have is water. Yeah, is water. We have been selling them off. Right now we have 10 big ones. Then recently one of them gave birth to 13. And also another one gave birth to 6. So they are like now 20 something, I think, roughly. If you get 13 plus 6 plus the 10, you see? Yeah. So all this, yeah, it's a real an achievement, because when those ones we sell them off, we shall get money. Yeah. But all that is the fruits from PHIT, I can say. We have 500 layers. So 500 layers, we get 15 crates every day. 15. So we sell a crate at 13,000 roughly, depending on how the market is. So roughly we can get simple calculation. We can get like a meter, like 150 roughly, I can say, every day. We can get that money. Yeah, if the eggs have not gone down, and we maintain that price of 13,000, we can get the money.
Well, Augustine, I am the project coordinator, the program coordinator for Maliba Community Health Initiative, whereby we deal in ICCM and of course support Vhts in various capacities. So our ICCM project, the Machi program, we started 2019, and since 2019 we have seen or managed to take care of over 20,000 children, and the success is that among the children that we have treated, there's none of the children that have died. That is a great achievement that we have seen, and also we have impacted lives of many, and of course children have gotten healed, and the mothers have saved money that would have been used to seek for care from other sections. Then they have been able to keep the money and use it for welfare enterprises. Then this project, in support of the Vhts, we have, other than giving them the medicine and the trainings and the other medical kind of support, we have also looked at their livelihood, whereby in addition to the poultry, the piggery that we have given them trainings on how to take care of the gardens, and of course like banana plantations, their coffee processing, and of course their financial literature, the way they should handle their finances. So we have also kindly seen how to improve the welfare of the whole area, because we are not only looking at the Vhts, we are also looking at the LC1 chairpersons, whereby even have brought them into that school and we have made sure that they are also fine. Because we believe that when people are wealthy, they are also healthy. So a healthy mind has to be a wealthy mind. That's it.